as we celebrate World Diabetic Awareness Day on November 14, let us all know the effects of diabetes on the eye. As you know, diabetes can affect any part of the body, so does it affect the eye? Today, India happens to occupy the second position in the world diabetes. Around 80 million people are affected with diabetes. So what is this diabetic retinopathy? This is one of the leading causes for blindness and is also a preventable cause of blindness in the world. So diabetes, it affects the retina of the eye. So this retina is nothing but a light sensitive layer which is present at the back of the eye. So diabetic retinopathy, usually it is asymptomatic in the early stages. Patients do not have any symptoms. Only in the later stages, they do have symptoms like blurring of vision, and they'll have black spots, and in extreme stages, total vision loss happens. So who are at risk of developing this diabetic retinopathy? Patients who have diabetes for a very long period, like more than 10 years, can be affected with diabetic retinopathy. And also the second cause is uncontrolled diabetes. Whenever the HbA1c levels are high, also the postprandial levels of sugars are very high, those patients are affected with diabetic retinopathy. Third thing is those who have hypertension. They have increased risk of developing this diabetic retinopathy. Even pregnant women who are being diagnosed with diabetes in the late stages of pregnancy can also develop this diabetic retinopathy changes. So how do we prevent this diabetic retinopathy? The key being early detection. Only when we diagnose these cases early and we treat them early, the vision loss is minimized in most of the cases. So a complete evaluation, a comprehensive dilated examination will help us diagnose most of the cases of diabetic retinopathy. Other factors which can lead to blindness because of diabetes are accelerated progression of cataracts. So if the diabetes is not under control, the stages of cataract usually progress at a very faster rate. So the changes that we usually see within a year, they happen at a very faster rate, like within 6 months. So we always recommend all the diabetic patients to have a comprehensive dilated examination at least once in a year.